Hello everyone, this is Respiratory Care Made Simple. Today we're going to make bilevel ventilation modes simple. Specifically, we're looking at the difference between S mode and S/T mode on BiPAP devices. Understanding this difference is extremely important because choosing the wrong mode can affect ventilation, comfort, and CO2 removal. Let's break it down in a simple bedside way. What is bilevel therapy? Bilevel ventilation provides two pressure levels, IPAP and EPAP. IPAP stands for inspiratory positive airway pressure. EPAP stands for expiratory positive airway pressure. Think of it like this. IPAP helps ventilation and CO2 removal. EPAP helps keep the airway and alveoli open. The difference between IPAP and EPAP is called pressure support. Pressure support is the main driver for tidal volume and CO2 clearance during non-invasive ventilation. What is S mode? S stands for spontaneous. In S mode, the patient must trigger every breath. The machine assists only after the patient initiates breathing. No backup breaths are guaranteed, so if the patient stops breathing, the ventilator will not automatically deliver breaths. This mode works best for stable obstructive sleep apnea patients and mild COPD support. It's for patients with a reliable respiratory drive who can consistently trigger breaths. The benefit of S mode is comfort and natural breathing synchronization. The downside is, if the patient becomes fatigued or weak, ventilation may drop and CO2 can rise. What is S/T mode? S/T stands for spontaneous/timed. This mode still allows spontaneous breathing, but it also includes a backup respiratory rate. If the patient does not trigger a breath, the machine gives a timed mandatory breath automatically. This is extremely important in patients with COPD with hypercapnia and neuromuscular weakness. Also for obesity hypoventilation, ALS, or fatigued respiratory muscles. The backup rate acts like a safety net. In COPD patients with respiratory acidosis, the goal is often to reduce CO2. Many think the backup rate is the primary method for CO2 removal, but clinically, the biggest factor is usually pressure support. Increasing pressure support improves tidal volume. For example, IPAP of 18 and EPAP of 6 gives a pressure support of 12. A larger pressure support usually means more ventilatory assistance and better CO2 clearance. The backup rate mainly prevents apnea, severe hypoventilation, and supports fatigued patients. But setting the backup rate too high can create problems like air trapping or poor patient comfort. To summarize, S mode is for patient-triggered breaths only. S/T mode provides backup breaths if needed. Final clinical pearl. When a COPD patient remains hypercapnic, do not automatically raise the backup rate first. Instead, evaluate pressure support, mask leaks, synchrony, and tidal volume. Successful NIV is about reducing work of breathing. Thank you for watching. If you enjoy simple respiratory education, make sure to like, subscribe, and share the channel.